So today I have the honor of speaking with a friend and a colleague from the East Coast, from Pennsylvania, Dr. Jennifer Fletcher Eckenrode. Jennifer's been a user of regenerative medicine for a long time before we even met. And today we just want to have a chit chat, a fireside chat, to talk about regenerative medicine and how you've been able to apply it. So thanks a lot for being willing to come on and chat for a bit.
Thanks for having me. Pleasure to be here.
It's probably really nice that everybody would know a little bit about your background. You've got a very interesting and colored background of going different places and then maybe a little bit about the practice, what you guys do as part of your regular practice, and then we can jump into Regen Med a little bit.
Sure. I'm a Colorado State University grad twice over. Got my DVM in 2010. Did a year-long rotating internship, specialty emergency and GP in Wheat Ridge, Colorado. And then moved out to the east to Pennsylvania. And I've been practicing at my practice at the Animal Hospital, Dauphin County, for 13 years now. We've been a very progressive practice from the get-go. That's what they said when I interviewed, and it was the truth. So I've been able to grow from being a general practitioner into the rehabilitation, pain management aspect. And I've been doing that for the past 7 years. I got my certification from Canine Rehab Institute 7 years ago, and have been basically transitioning over the course of 7 years from one day a week of being a rehab vet to now 3/4 of my time is dedicated to rehab and pain management. So one day a week, I'm still a general practitioner, and although I see a lot of ortho cases that so.
As do most general practitioners, right? You see everything. So let's jump into regenerative medicine a little bit. Maybe just talk a little bit about how did you come to regenerative medicine? What attracted you? How long back was it? And why? Why did you decide that that was an interesting tool to learn?
Yeah, that's a great question. I'm having to dive back myself. I would say when I joined my practice, we had a different surgeon at the time who I think introduced the PRP into our hospital and did some joint injections. Then we started in 2016 doing clinical trials. So I kind of dove into it there. She was doing platelet-rich plasma and her TTAs. And so it was kind of a bit of a standard of practice to do injections post-TTA. We now have standard of care being basically every owner with a TPLO is offered PRP post-operatively. And I would say we probably have about 95% compliance on it.
It's a really good segue into that. Like we treat this sometimes as it's an alternative, not necessarily an adjunct to surgery.
Right.
And using it with surgery makes so much sense. It's being used very commonly now on the human side, but people think, oh, well, it's either regenerative medicine or surgery, and not the case. Funny enough, on the human side, we hear all the time, it gets patients back into rehab faster because they get a pain reduction. And I don't know if you see that the same in your rehab practice.
I do, where the dogs were coming from a post-op TPLO from our current surgeon who had PRP or from an outside surgeon, a different practice without PRP. Our PRP dogs have less joint effusion, faster to weight bearing, better weight bearing at the 2-week mark. I'd really like to do a study on that just because I see a vast difference in it. So I've been really with the PRP cases in the post-op TPLO setting.
How do you present this, and in particular in this case where you're presenting it for a surgical adjunct, how do you and your other veterinarians talk to the clients? How do you explain this thing that they might have heard of or maybe not?
Yeah, it's interesting because a lot of owners have heard of it / had it, which I mean, it's a small population of people, but they're just like, oh yeah, absolutely. I call it a bioactive agent where we're getting good blood flow back to the joint and, causing the cells to activate, signaling for healing properties. So I think I focus on the fact that we're helping the joint heal.
Yeah.
Rather than just suppressing inflammation that keeps getting suppressed. We're trying to change the physiology of the joint.
Yeah.
And I think that's what really owners like as an approach rather than just using, meds, whether it be post-op TPLO or as an arthritis tool. They really like the fact that we're trying to do something to make the joint better. So.
Tell me about when you started with regenerative medicine. You weren't using VetStem materials back then. You had started with a different sort of approach to it, and I think also making the centrifuge-based PRPs, right?
Right. Yeah. Just standard centrifuging, draw 12 milliliters out of the patient, 45-minute time from blood draw to using. And it's a real kind of, it's a stopgate on your day. I'll tell you that, because the dog's got to get there. The tech's got to draw the blood. I have someone dedicated to doing 45 minutes. So what my struggle was is I have a fair amount of very anxious dogs that I work with. And I sometimes can't do blood draws on them unsedated. So even gabapentin, trazodone, the whole thing. So we have to sedate them, draw the blood, process it, keep them sedated until I could do the joint injection.
Yeah.
That wasn't fun.
Yeah.
So yeah, having something where I don't have to do that anymore was really appealing to me. Also we've x-rayed it. This dog's from 2 hours away. I have a lot of clients who come from several hours away, and I inject them in the same state as diagnosing them. So,
yeah.
It's nice. It's been, and just the fact that I had no way of really kind of quantifying platelet counts on my previous product to know like what I was actually injecting into these dogs. I was just hoping the patient had what I wanted them to have. So consistency of product was also something I kind of wanted. So I've been happy with the Precise. It's easy to use. And yeah, I mean, I have probably 3 or 4 vials just sitting in the office waiting for me to use.
Literature, if you go look on PRP, is highly variable.
Mm-hmm.
I think that last check, about 60 or 70% of all papers on PRP efficacy in veterinary and human don't tell you the platelet count, nor the white cell complement in the PRP. So now we're trying to figure out what went wrong, if it worked or it didn't work. And it's been a real mess from a literature standpoint. And so people go, well, I read the literature and sometimes it works and sometimes it doesn't.
Right.
Part of that is this high variability with patients. And, if you get a difficult stick, and some of those ancient patients, just like in human geriatric medicine, you don't get a good draw and it comes really slow and the vessels are a little bit friable. They're probably inflammatory. Now, when you do the processing, you still get a product out, but you might have lost a lot of the growth factors, the anti-inflammatory and pro-growth factors that we want, and you never know it because you can't measure those.
Right.
So you throw that away in the platelet pore plasma, and you're using what you think is a good product. We get a lot of comments from surgeons, and I wonder if you get the same thing, that surgeons that are reluctant to put a PRP in a surgical site after a surgery because of the unknown sterility, whether it is or it isn't, and they've got a susceptible site. We had a number that were trying to do cruciates, and they just, wow, man, I don't want to put PRP in because I get some infections anyway, and I'm going to get blamed if we have an unsterile product or an unknown sterility product. And that was one of the reasons that drove us to do, an off-the-shelf sterility checked product, so that at least that's when you can check off,
There's a lot of factors where contamination can happen in a centrifuge product too. So,
Absolutely.
One little question being asked to the technician doing it, make, one little error and don't realize it.
Having either a stem cell or a PRP product that's also antibacterial, in addition to being a sterile off the shelf, really, at least it helps ease your mind over that.
Yeah. I would almost trust the off the shelf versus the centrifuge. There's too many factors in the centrifuge.
Yes. Well, I think, as you know, one of the reasons that we decided to do an off the shelf product is the product we were selling that was not a centrifuge base. We have one of those. We've done a gazillion of those, but we also had that nice gravity feed system. It was a human company, and they pulled it off the market and said, we don't want to sell to vet. We're not even going to sell this product anymore. So it forced us to come to the conclusion that we needed to do something new. And this idea of having a truly off-the-shelf, can use it quickly, was very enticing. One of the things I didn't, because I was not a small animal practitioner, I didn't think about is these tough patients. And you pointed out one group, which are the old dogs. The other group, which people talk about a lot, are the micro dogs. You drawing 30 mils of blood from a little micro chihuahua is you're going to make your technicians pull their hair out, I imagine. We get calls from people that are only rehab facilities, and they go, oh, well, I can't do surgery, so I can't do your stem cell stuff, and I don't want to put in centrifuges and do all that. We're now going back to them and saying, hey, God, it's just an injection.
Yeah, I don't have to get a centrifuge, which is really nice. I think joint injections, PRP, just lives in the rehab realm. I think rehab vets need to realize that we are not just in rehab, we are in pain management, because as they teach at CRI, I got my certification, is you treat pain first. And if you're not treating the pain first somehow, then you're not going to get the move. So we are in pain management. Our rehab vets need, I think, to take that next level. It doesn't need to belong in the boarded rehab specialist hands. This is something that everybody can learn to do. People are looking for it. I have someone coming from 2.5 hours away, specifically looking for PRP for their dog. And they're looking for that answer that isn't just meds. The dog's been on everything already. I mean, name it, it's been on it. So, and now they're looking for something that this is going to be the better steps.
I hugely respect what you do in the physical therapy realm. It makes a big difference in dogs. As I know, it makes a huge difference in horses. In sports medicine and human, it is now the core, and everybody's using PRP. All the pain management clinics now do that. So your owners will come much more often and say, wait a minute, I got PRP in my knee. How come my dog can't get it? Yeah. So it will get there for sure.
Yeah, I'm excited. This is great.
But I really appreciate your insights. You're one of the innovators, but you're just using it logically, and I really appreciate the input. It will help other practitioners, and I know you do mentoring programs. This is intended to be a mentoring program where somebody in general practice or in rehab, they're scared to do it because it looks new and they didn't get trained. Should I do it or not? And as you said, it's not that complicated.
Yeah,
it's pretty straightforward.
Yep, absolutely. Well, thanks for having me. This has been great. Thank you.
And thanks again for all the time. Really appreciate it.
Thank you, you too.